and killing large numbers of Kenyans. Indeed, at the beginning of the pandemic, our medical experts had estimated that if we had not taken action, they had projected 10,000 people would have been infected by the end of April. However, due to determined mitigating measures, both by the national government and our county governments, we are now only at 343 confirmed cases, and I want to take this opportunity to thank the millions of Kenyans for showing discipline and responsibility, because it is this attitude by law-abiding Kenyans that is saving thousands of families from grieving for those who would otherwise be lost to the coronavirus. Indeed, on behalf of a grateful nation, I also take this opportunity to extend our appreciation and thanks to the many thousands of health and security officials standing on the front lines against this most formidable foe. Indeed, while we continue to mourn the 14 who have succumbed to the disease, we also celebrate the 98 recoveries that we have seen so far. I am encouraged by the progress we have made, but I wish to remind Kenyans that we are yet to be victorious. And that is the reason why today I wish to announce the following additional measures. In accordance to the advice given to me by the National Emergency Response Committee on the coronavirus pandemic, the National Security Council has sanctioned the following additional measures to protect lives and to protect our country. That the cessation of movement into and out of the Nairobi metropolitan area and the counties of Kilifi, Kwale, and Mombasa that are currently in force shall be extended for a further containment period of 21 days. That the nationwide dusk to dawn curfew that is currently in force shall also be extended for a further period of 21 days. And to ensure that porous borders and security threats do not compromise our response to this pandemic, the security services will upgrade their alert and response measures in every border area. Additionally, the counties of Mandera, Kilifi, Kwale, and Mombasa have registered through their governors an increase in cases of infection and have reported this. And today we say that if this worrying trend does not reverse, more stringent measures will be taken in consultation with the respective county governments. I will continue to use the best scientific and medical advice to calibrate our response as a nation, and we shall escalate, or for that matter, de-escalate, on the basis of how vulnerable we are to large-scale infection. Making determination with targeted mass testing, and we are working hard to overcome constrained supplies of testing equipment in order for us to expand our capabilities nationwide. Fellow Kenyans, I am indeed profoundly conscious of the economic and livelihood distress many Kenyans are feeling at this particular moment. And this is why we are going to continue to roll out initiatives that offer relief, particularly to our youth and our families in distress. The next initiative, of which will commence on Wednesday, the 29th of April, is an initiative that we're calling the National Hygiene Program. And I believe that this is an initiative that will create jobs while making our environments healthier. The first phase of the National Hygiene Program for the next 30 days will employ some 26,148 workers and eventually grow to over 100,000 young people across the country. This added to the already existing 108,000 vulnerable households that are presently receiving direct cash grants, and the 8 billion Kenya shillings that our senior citizen program and vulnerable families are getting, which I believe will continue to offer tangible relief to the most needy in our society. The inaugural cluster of employment in the program that I have just announced, the National Hygiene Program, will involve residents in 20 residing in these settlements, and for their neighborhoods, they will make up to 250,000 masks per day. This intervention, I believe, stimulates the local economy while advancing the war against coronavirus. We have also decided to move in phases to ensure that those being employed work under proper health standards and protocols that will help us limit the rate of infection. Indeed, as we get better and more practiced at implementing work protocols, we will increase the amount and number of people employed. As this phase is rolled out from this Wednesday, phase 2 will be getting prepared. Its scale will be much greater and its area of focus will be nationwide. Additionally, there are already aspects of the post-coronavirus economic recovery plan that we are progressively rolling out. And my administration shall in particular activate micro, small, and medium enterprises across our country to manufacture basic medical equipment and supplies for domestic use and for export. This initiative, because we do believe we shall defeat the coronavirus, shall be nested under the universal healthcare coverage agenda and will utilize approximately 1.5 billion Kenya shillings, and the Juakali sector shall take the center stage in production while leveraging on our technical and vocational educational training centers, as well as the constituency industrial development centers. And to this end, I do direct our Ministry of Health and the Ministry of Industry and Trade to expedite the rollout of this initiative across the country, and I do encourage our governors, to whom health is one of their key roles, to please help us and support us in supporting these young men and women working in our SMEs. Our victory will come from a whole of society approach to fight this virus, and this includes our individual and collective acts of solidarity with others as individuals, as I said, as institutions, but also as a country. Indeed, I want to confirm today that I have spoken to most of our development partners across the world, and I have found a very positive response. In the next couple of weeks, I believe that we shall have billions of shillings that will be added through our own initiatives as well as our development partners, and these will be added to some of these initiatives that I have announced today to offer direct relief to Kenyans. And I want to thank each and every partner for their solidarity and willingness to listen and to respond to to our proposals. In the same breath, I would also like to express my heartfelt thanks to our National Assembly for rising to the challenge and seeing the merit to approve the tax measures that my administration had prepared. And I want to thank our legislators, and we will now ensure that employees have more of their earnings available for them to spend, and that we reduce the corporate tax burden as an incentive to business enterprises. And I expect these measures to complement all the other measures that the government has and is taking to minimize the negative impact and on the welfare of ordinary wananchi. I also want at this point to specially recognize and thank the very, very many active community groups that are of their fellow citizens. I want to express my thanks to members of Shining Hope Community, the Green Card, Mtaani, Ghetto Classics, Torch Women, Women in Business, many individual, corporate, and individual partners, including Beyond Zero. And I want to thank you all for the efforts that you are making to partner with us as government as we alleviate the stress that many vulnerable groups are going through. Let me say, fellow Kenyans, that we are not going to be in this situation forever. There will come indeed a day I also believe that by being disciplined, patriotic, and empathetic, we can achieve a victory. As I have stated, we will continue to be guided by the medical expertise, science on how to escalate, and again I repeat once more, or de-escalate our response to this pandemic. I believe that we are now in the middle of a war being fought in every street, in every homestead, every building across our country. The key for all of us to return to normal is keeping our infection rates falling and raising our testing rates. So far, as a country, we have tested 92 persons and are proceeding with mass targeted testing. This is giving our experts the data and that we shall make into the future. I want to be categorical and once again re-emphasize that government, will not delay in de-escalating the measures that I am announcing today the moment our experts, because it is they in whom we should trust, inform us that the risks have reduced significantly on the basis of how we as governments, national and county, but also as individual citizens, shall respond to the directions that we are given by our experts. Indeed, I have directed, for example, the National Response Emergency Committee to map out the economic sectors and activities on the basis of infection risk. The mapping exercise, when combined with increased testing and more exact contact tracing, will inform how we reopen our economy progressively. One immediate step from the work done so far is that we shall allow a few restaurants and eateries in selected counties that show the highest levels of health regulation compliance and the ability to arrange for employee testing to undertake minimal operations while maintaining measures that mitigate against the spread of coronavirus. The Cabinet Secretary of Health will in due course be announcing and release the protocols that we shall expect these facilities to abide by. Any report by the public or authorities that these establishments that we shall be reopening are not following the laid down measures and protocols will lead to their instant closure and indeed follow-up prosecutions. We will reopen our economy, but this must be in a way that does not endanger many thousands of lives. Some countries, as you all well know, had initially succeeded in suppressing the pandemic, only for them to open up without proper process and consequently suffer a huge spike in infections. We don't want to go that way. So, as we move on, our long rains are here, and while we are grateful for the blessings, the heavy rains in many parts of our countries have also, unfortunately, led to flooding, land. We mourn the 29 Kenyans who have lost their lives in Elgeyo Marakwet and West Pokot, and my administration continues to make every effort to support affected families and communities across the country. We continue to warn our fellow Kenyans that coming out of last year, where the rains were still very heavy and now are heavy once again, the risk of flooding, the risk of mudslides are increasing, and I would request and really plead with all Kenyans to follow the advice that is coming from the Ministry of Interior, that is coming from our meteorological people, that please let us move to higher ground, let us move from areas that have the potential of creating havoc, areas of Tana River, areas of Kitui, parts of Makueni, parts of Murang'a and Kiambu, Elgeyo Marakwet, areas like West Pokot, areas in Nyando, and other such areas prone to flooding. I do request that our citizens work with civil administration to ensure that we move to safer ground and remove ourselves from the risk of the danger that may be posed by these heavy rains. We, on our part, have mobilized the deployment of resources, including rescue personnel from our various security and humanitarian agencies, covering the Kenya Defense Forces, the National Police Service, the Ministry of Special Programs, amongst other agencies, to assist in these affected regions so as to provide emergency response, mitigation, as well as preventative action. Let me finish by reminding every Kenyan that we will and can get to the end of this challenging period, and we can overcome this pandemic. We will return to our workplaces. We will see our family and family members and friends again, and we will return to the precious work of building our nation, not only for ourselves, but for our children and our children's children. We are all in this together, fellow Kenyans. Health for all in Kenya, goodwill to our neighbors, a helping hand, reaching empathy to those struggling. In short, security by all, for all. I take this opportunity to call on all Kenyans from yesterday to wish me or to join me in wishing our Muslim brothers and sisters a blessed holy month of Ramadan. They will observe this period, as we have stated, within the guidelines given by the Ministry of Health. And as I said, over the Easter period, this time we may be forced to celebrate in our homes, but I believe that those prayers will ultimately be received by God Almighty, and He will help us overcome the pandemic that is before us. Our prayers once again, and thanks to our brave and dedicated medical professionals, our security services, our county governments, and all the support staff and essential service providers. And we thank God for those who are working every day to save lives and to safeguard our country. I want to thank you once again, and may God bless you all. Na niseme wenzetu, tunajua tuko katika wakati mgumu, lakini ni jukumu yetu sisi wote tuungane, tunaweza na najua tutashinda huu ugonjwa tukiongozwa na Mwenyezi Mungu, lakini lazima kila mmoja wetu ajue ya kwamba ni jitihada yake kibinafsi ambaye itatusaidia kujiokoa na kuokoa maisha ya wengine. Tuwajua ni wengi ambao kwa sababu ya vile uchumi haswa upande wetu wa utalii na magavana ambao tuko nao hapo siku ya leo ndio wameumia zaidi kwa sababu ya ukosefu wa biashara, ukosefu wa watalii, mahoteli yetu zingine ambazo zimefungwa. Lakini mimi sina shaka ya kwamba tukishapambana na tushinde huu ugonjwa na tuendelee kushirikiana na kuungana kama Wakenya, tutaweza kurudisha uchumi wetu, tutaweza kurudisha na kuhakikisha wananchi wetu wamerudi kazini. Lakini lazima niendelee kusisitiza vile nimesema, tunaendelea kuona huu ugonjwa ukizidi kuongezeka katika sehemu tofauti tofauti, na lazima tukubaliana ya kwamba huo ndio ukweli. Na wenzangu, ombi langu vile nimewaomba tena na tena ni ya kwamba ni jitihada zetu za kibinafsi haswa ambazo zitatusaidia kupambana na huu ugonjwa. Tuataka uchumi wetu uanze kufanya kazi tena, lakini wale wachache ambao wametoa for example ugonjwa huu, wametoa ugonjwa huu hapa Nairobi, wamepeleka mpaka Mandera. Mandera sasa tumefunga. Kwa nini? Sio kwa sababu ugonjwa ulitoka Mandera. Ugonjwa umetoka hapa Nairobi kulingana na wale ambao walikosa kutii ile amri ambaye tulikuwa tumeweka. Jameni, hatutaki kuona hii ugonjwa ukienea sehemu zingine kwa sababu ya ukosefu wa nidhamu na heshima kwa Mkenya mwenzako, wa ule ambaye anajua ya kwamba anatembea na ugonjwa na anahatarisha maisha ya mwenzake. Kwa hivyo Wakenya, tuungane na tutaendelea vile nimesema kulingana na ile nidhamu sisi wenyewe tutaweka. Tutaendelea kuona kwa sababu hatutaki kuongeza vikwazo, lakini kama itakuwa lazima tuongeze vikwazo tutaongeza. Lakini nia yangu na ombi langu, na najua ombi la Wakenya wengi, ni ya kwamba tunataka kupunguza yale masharti ambayo yako, kwa sababu sisi wenyewe tumetii maagizo yale ambayo tumepatiwa na Wizara ya Afya, na ndio tupunguze huu ugonjwa na tuweze tena kurudi maisha yetu ya kawaida. Kama serikali haswa katika hizo counties ambazo sasa zimefungwa sana, tutaendelea vile nimesema kuona ni kwa njia gani tutasaidia zile family ambazo zimeathirika zaidi. Tutaendelea kuona ni programs zipi ambazo tutaweza kubadilisha za serikali, ndio kama hiyo nimesema, hiyo hygiene program ambayo tunataka kuweka katika mitaa yetu, kwa sababu tunataka wananchi wetu waweze kuwa wako na kazi ambao wanafanya, haswa wale ambao wameathirika zaidi. Vile nimesema, wale ambao wanafanya kazi kwa mikahawa na kwingine, ni kwa njia gani tutaweza tuwasaidie, watusaidie kusafisha masoko, watusaidie kutengeneza drainage na barabara na mambo mengine, at least tuweze kupata riski ya kila siku wakati tunagojea uchumi wetu wa kikawaida urudi. Kwa hivyo nataka kuhimiza ya kwamba sisi kama serikali tutafanya lolote ambalo tuwaweza kulingana na hali yetu ya kiuchumi na hali yetu ya fedha. Lakini mwishowe hakuna kitu ambayo itatusaidia zaidi isipokuwa kuvaa maski kama hii, kuosha mikono, kuweka social distancing, ukikohoa ujifunge mapua. Mambo hayo serikali haiwezi kulazimisha. Ni wewe kama binadamu, ni wewe kama mwananchi ambaye waweza kutusaidia sisi wote wananchi milioni 40, sasa karibu na 6 na 7. Kwa hayo machache sitaki niongeze zaidi, lakini kwa sababu niko na wenzangu hapa magavana, ningependa niwaalike hapa pia waweze kusema machache kuhusu vile wenyewe tunasaidiana na vile wenyewe wanaonelea tuwaweza kufanya. Njoo hapa, waachana hapa, wacha kuja hapa. Njoo ndugu.
Asante, Your Excellency. Let me say that tuko katika mtihani mkubwa ambaye Mwenyezi Mungu ametuletea. My message to all of us today, there is that much your government can do and your government is doing. Lakini the fact of the matter is that if you looked at practices around the world, is that 90% of the responsibility lies with you. You can avoid going to the hospital. You can avoid being put in a ventilator. You can avoid many things if only you adhere to the regulations and the rules that are provided for by the government. Our observation, ambayo tumeona kule kwetu, Your Excellency, and that is why we have come to share with you. They may need a decision kuongeza vikwazo. And the sufferer of the vikwazo ni mwananchi. But then again, the solution lies with the mwananchi. Only if the mwananchi agrees to what the practices or the advice or the regulations that are given by the experts, then we can change the conversation as quickly as possible. But in my county today, Your Excellency, the graph is going high. We've had to struggle. People don't listen. You're not doing it for me. You're only doing it for yourself. You're not doing it for your government. You're doing it for the people you love. Or at least kama hujipendi wewe kuna watu wanakupenda. Do it for the people that love you. So Your Excellency, we are here in solidarity. We've been consulting with you closely, and we will not hesitate, even as Mombasa, we will not hesitate when it gets to a point when we tell you, escalate the actions to stringent measures so that our people can listen. But I can tell you, we can avoid going there only if we listen to what we've been told. Like I said, 90% of the responsibility is with the mwananchi. The doctors, the clinicians, the government can do that much. But you can avoid even going to hospitals. You can avoid contracting coronavirus so that you don't need to be put to care by only wearing mask, washing your hands, using disinfectant, observing social distancing, and stay at home. Thank you, sir.
Governor Mahuria.
Asante sana, Your Excellency. Wakenya wenzangu, tuko katika vita dhidi ya virusi vya corona. Vita hivi havihitaji risasi wala bunduki wala guruneti wala kifaru. Vita hivi tutaweza kushinda tukiwa na nidhamu, tukiwa wazalendo na tufuate yale masharti yote ambayo yameweza kuwekwa na serikali. Tuyaunge mkono kanuni zote ili tuweze kujikinga na virusi hivi, tuweze kuwa salama, familia ziwe salama, nchi iwe salama, uchumi urudi kama vile ulivyokuwa. Kaunti yetu ya Kwale imeathirika sana kwa sababu ya utalii, hakuna tena, umezorota. Kwa hivyo tunawauliza kila Mkenya tuweze kuunga mkono juhudi ili uchumi wetu urudi vizuri. Pia tunajua kuna tishio ile ya mpaka wetu na Tanzania. Kwa hivyo ni jambo ambalo tunazungumza na Mheshimiwa Rais ili kuona kwamba ni vipi tutaweza kudhibiti. Otherwise, I want to say that the county governments, the national governments, we have come together to defeat Corona, and we will support all the initiatives so that we are able to rescue and have our people to be safe and healthy. But this will only happen if we have our own self-discipline, individual discipline to follow through these transformational messages that are being relayed by government, which are mostly on behavior change, hand washing, social distance, and making sure that you maintain all the measures that have been relayed by government. Thank you very much, and we continue to support you, Your Excellency.
Governor Kingi.
Asante Rais wetu. Wananchi wenzangu, vita dhidi ya corona havina mtazamaji. Ikiwa vita hivi tutavishinda, ni lazima sote tuwe maaskari. Serikali ya kitaifa na serikali za kaunti zimetoa mikakati, masharti na kanuni nyingi ambazo bila shaka sote tukizifuatilia kikamilifu tutajikinga dhidi ya uambukizaji wa virusi. Kwa hivyo ni muhimu kwamba wananchi wote wawe na nidhamu ya kibinafsi. Chambelecho cha Waswahili wanasema kwamba unaweza kusukuma ng'ombe mpaka ifike kwa mto, lakini kunywa maji mtoni ng'ombe ni hiari yake. Tutaweka masharti makali, tutawapatia vitu vya kuwasaidia, lakini baada ya kwisha vile nidhamu zetu zenyewe na kutekeleza sisi wenyewe masharti haya ndiyo itatuokoa. Kwa hivyo ni muhimu kwamba Wakenya wote kwa sasa tujitokee, tuwe maaskari katika mstari wa mbele wa kupambana na virusi hivi vya corona. Ni aibu kubwa kwamba lazima askari wasimame mbele yetu. Ni aibu kubwa kwamba viongozi wa kisiasa ama viongozi ndani ya serikali lazima wawe karibu nasi ndio tuvae mask ama ndio tuoshe mikono. Wakenya ni lazima tutekeleze masharti haya, ikiwa kuna askari ama hakuna, ikiwa kuna kiongozi ama hakuna karibu na, manake ukifanya hivyo unajilinda wewe mwenyewe. Tukifanya hivyo bila shaka maambukizi haya katika Jamhuri yetu ya Kenya yatakuwa machache zaidi, na hapo ndipo uchumi wetu kunaweza kufufuliwa na kufunguliwa kwa mapema kama vile Rais alivyosema. Asante.
Asanteni sana wenzangu, na washukuru sana kwa haya, na vile nimesema tutaendelea kushirikiana. Sio tu na hawa wa magavana, lakini hawa ndio wameathirika zaidi kushinda labda kaunti zingine, tukiungana pamoja na Nairobi na sasa Mandera. Na ndipo nikasema ni vizuri tuwe pamoja. Na vile Governor Joho amesema, sisi tuataka kupunguza yale masharti, lakini hatutasusia kuongeza masharti kama wenzetu wa Kenya hamutaweza kutii yale ambaye tunaelezwa na wale ambao wanahusika, na haswa wataalamu wetu wa kiafya, madaktari wetu, mascientist wetu. Hawa lazima wawe ndio watatuongoza. Na kama serikali, na kwa nia ya kulinda maisha ya wananchi, tuwataka sisi kama ni kuulizwa tupunguze kafyu, tuondoe hiyo masharti mengine mengi ambayo tumepatiwa, lakini hatutasita kuongeza tukiona huu ugonjwa bado unaendelea kukua, na haswa wakati huu ambapo tunaingia kipindi cha baridi, kipindi cha mvua. Kwa hivyo Wakenya wenzangu, tushirikiane na tusaidiane. Nilikuwa nawasiliana hapa na waziri wetu wa afya, na nataka niwaambie na niwahakikishie ya kwamba kulikuwa wengine ambao kwa interview walikuwa wanasema ya kwamba kuna utafiti ambao unaendelea hapa ambao will involve or Kenyans are involved in being used as guinea pigs for a vaccine test. Hakuna ukweli hata kidogo kwa haya madai. Ukweli ambapo uko ni ya kwamba institutions zetu kama KEMRI, kama Kenya Primate Research Center wanaungana pamoja na wengine kutafuta dawa, kutafuta vaccine ya hii ugonjwa. Na kama kutakuwa na kutafika wakati ambapo hawa wataalamu wetu watatuambia labda wameweza kudevelop vaccine to the point ambapo it shall require human trials, tutawaambia. Kwa hivyo msidanganywe ya kwamba kuna lolote ambalo linaendelea kuhusu testing ya vaccines ambazo hatujui hapa kwetu Kenya. Yeah? But our institutions, like I said, specifically KEMRI, Kenya Primate Research, and others, are involved in the global effort to try and find a vaccine. And once we have found one, once we have reached an area where these trials can be tested on humans, fellow Kenyans, as we have been briefing you on a regular basis, we shall keep you informed and we shall let you know, and nothing shall be done in the dark. You will be informed. So I keep appealing to Kenyans, I keep appealing to those who are passing on unverified information. Please do not cause panic, do not cause uncertainty amongst your fellow Kenyans. Kwa hayo machache, tuwasema, tuwatakia Waislamu wenzetu, ndugu na dada wenzetu, Ramadhan njema. Tuwauliza muendelee kuombea taifa letu, muendelee kuombea Wakenya wenzenu, muendelee kuombea amani, muendelee kuomba ya kwamba tutaweza na tutashinda jangwa hili la corona ambalo limetupata. Kwa hayo machache na mengi, nasema Mungu awabariki nyote, Mungu awalinde, na tutaendelea kuwapashia habari muda kwa muda wakati tuko na mapya na mengine ya kuwaeleza. Asanteni Wakenya wenzangu, shukran.
Since late last year, the coronavirus COVID-19 has emerged as a serious healthcare threat. This is an infection that has gone global and no one has been spared.